Mr. President, let's move to health care because some of the same people who were at odds with President Clinton tried to block his initiatives 15 years ago are at the table today. What's changed?
Well, a lot's changed. What hasn't changed is the ever-escalating cost of health care. And so people have seen since '93, when we failed to reform health care, that costs have continued to skyrocket. I think probably the biggest change politically is that businesses now recognize that if we don't get a handle on this stuff, that they are going to continue to be operating at a competitive disadvantage with other countries. And so they anxiously seek serious reform. The fact that we've got hospitals and doctors who also recognize that the system's unsustainable on its current path. Fiscal conservatives who recognize that the single biggest component of driving down our deficits and long-term debt is getting control of Medicare and Medicaid costs, and that healthcare reform is critical to bend the curve. All those things, I think, have converged. And you are absolutely right. The meeting we had here with insurance companies, drug companies, doctors, hospitals, labor, all the stakeholders involved, nurses, we haven't seen that before. Now, it's still going to be very difficult to get a bill passed, but I'm absolutely committed to keeping this process moving, keeping a conversation going, focusing on how do we reduce costs, how do we increase efficiency, how do we make sure that families have some confidence that they can get health care when they need it and that they won't go bankrupt because their child gets sick. I really think that the stars may be aligned here, and we potentially can get it done if everybody comes at it with a spirit not of ideological rigidity, but if they come at it with a sense that, in a practical, hard-headed way, we can really negotiate and compromise and get something done for the American people.
But you say